Okay, we'll try it again. So thanks for your patience as we get connected today. This is, as we were talking through earlier, this is learning session number 3, and this is being recorded for all of our partners who aren't able to join in on the discussion today. This particular session is how to customize the CDEMS progress note. And like we were saying earlier, the sessions that we're having with you, these learning sessions, are becoming more and more specific over time, which is good. And I mentioned before that what we're most happy about is the dialogue and the emails and the web sessions that we've been having with you all in between these learning sessions. We've been doing some very practical things like importing data into CDEMS and resolving some issues that we've been having with data files and helping to correct some errors that have been popping up in the registry across different partners. So those sorts of things are really essential to take care of. We appreciate that you've been telling us about those issues that have been sometimes long-standing, and we're really glad to get those things resolved and out of your way. So we can have a good session today about this particular topic, and feel free to interrupt us along the way and ask questions, and we'll go through a few slides together, and then for practice we'll go into CDEMS and start to modify the progress note based on different scenarios, and we can just talk with you as we do that and get your take on how you would want a progress note to look, and we can try modifying it during the session to suit what you would want out of it. So I'll go ahead and get started in these slides, and then we'll have a more interactive portion of the webinar. So we wanted to acknowledge the Pacific Chronic Disease Council and all of its partners for the engagement and the very worthwhile work that we're able to do together. And I did want to give special thanks to Gwen Hosey for helping to get these efforts going. And we really value everyone's leadership and input in this entire process, and we're glad to be a small part of that team, and we're glad to do what we can to help make this work sustainable and beneficial to your patients. So I'm here with Cecil Pollard and Mary Swim with the Office of Health Services Research at West Virginia University. So a little bit about us, and I won't dwell on these points. I've covered these issues before, but the mission of our office is really to help improve the delivery of healthcare and ultimately health outcomes of patients with priority health conditions. And what we deem to be priority health conditions are the ones that our partners find important. So diabetes, obesity, high blood pressure, depression, those conditions come up again and again. So we do our best to help our primary care partners have good tools to track those health conditions and to really have good data to work with to inform interventions and patient care. All of our work is data oriented, and often the partners that we work with have so much data at times that they're not exactly sure what to do with it. So we like to turn that sort of scenario into a better one, where you have a good plan in place for exactly what data it is that you need to collect and what you want to do with those data once you have them in place. So it's really a process of going from having data sets into information or knowledge that on patient care, and then moving further into how those data can be applied or put to use. As far as the progress note, so this session is about modifying the progress note. We often recommend that you start with the end in mind in terms of modifying the progress note. So what data exactly do you need for all of the required reporting that you are responsible for around diabetes? And layer on top of that, what are the additional quality improvement measures that you as clinicians, as healthcare professionals, want to know about. Often there's a little bit of a gap in between what you're required to report on and what you may want to know about as a healthcare provider. So, what data do you have to have? What data do you want to have? Those two questions really go into the design of the progress note in terms of its contents. And whatever you have in the progress note is going to dictate what you're able to report on. So this is about the progress note in particular, the third step in that diagram. But whatever that progress note holds is dependent on steps 1 and 2. And all 3 of those steps, dictate what you're able to report on in step 4. So, what data do you need? What data do you want? That'll inform your progress note design and also drive your reporting capabilities. So as we look at the progress note, and we'll focus on diabetes, we can look at some of those common measures that are generally always included, and then we can take feedback from you on, do these measures make sense, and what else would you like to have involved in a diabetes progress note? So, Cecil, I'm echoing. So all of the information that we're going to cover stems from functions that are in the Utility tab in CDEMS. So this is part of the CDEMS app. And on the user guide, just for reference, this is page 18. Everything that we'll do in customizing that progress note all happens in one area, Setup Wizard. Nice and easy to find, Utility tab. And whenever we click that, we'll look at this in a live version, but that Setup Wizard is going to bring up a simple form. So we'll go through each of those steps involved in modifying that progress note. But CDEMS is all based on, it's a diagnosis-driven registry. So whatever health condition you have in mind, that's what you focus on first, and then variables or data points in the registry are associated with each and every health condition. So you could have something very lengthy and complex for type 2 and type 1 diabetes, or you could have something very, very small and streamlined for another kind of health condition. It just depends on what it is that you want to track, and we'll go through some examples of that.
Somebody said they couldn't hear you.
Can't hear me. Okay, let me take a look and see what I can do about that. We can't hear anything. Oh my.
Sure.
And that was about 9 minutes ago. Okay. For other folks on the call, are you able to hear me?
Yes.
Okay. All right. Thank you. So we have Majuru, Ibai. Let me look at the audio settings.
Caption command.
Hmm?
We need some closed captioning, perhaps.
So our folks in Majuru, are you able to hear anything? I'll also message you over the chat. Well, I'll keep moving for now. The session is being recorded. Oh, so they wrote back and they said, no, can you hear us? No, I cannot. I'm not exactly sure what I can do to help with that.
I'm telling you, it's going to be recorded.
Okay. Do I have to enable anything?
Maybe Cecil can text them a note or two, how to add things over the slides, maybe they can follow.
What would they adjust to get theirs?
I'm asking if their volume is up or down. That's one very simple thing that they could try.
Do they have a speaker?
So Majuru's offline now. Well, I'm going to go ahead and keep moving for the sake of everybody that is on the call. The session is being recorded, which I think is going to come in pretty handy here. I apologize for the technical difficulties. I'm not exactly sure what the problem is. It's a little bit beyond my control at the moment, but we'll do our best to have the best discussion that we can and send the recording out to everybody for reviewing at a later point in time. So we'll step through the setup wizard together in a more live sense in CDEMS, but I wanted to point out the main form that we'll be using whenever we do that. And we want to be very accessible to you as you have questions not just during the session, but afterward. Here's our phone numbers and email, and we'll welcome contact from you at any time. And we want to do our best to make sure that the registry is going to fit your needs and that you have your questions met along the way. So I'll go ahead and get out of the presentation and I'll go into the registry and we'll start to take a look at the setup wizard together. So I'm going to the CDEMS app. There's two main components of CDEMS. There's the app and the reporting tool. The app is where you can view patient data, enter new data, edit existing data, and make some modifications to the registry. So that's the part that we'll focus on today. Okay, so as we saw in the PowerPoint slide, we'll take a look at the Utility tab and the Setup Wizard. Okay, so here's the form that we saw in that slide. So it says Step 1, select health conditions or enter a new health condition. So if we want, so you see all of these related boxes currently are blank. We have a related diagnosis, related prescriptions, related services, labs, and measures. All of those things are currently blank because we haven't selected a health condition yet. But we'll click on this drop down in Step 1. We can choose any of the health conditions, but for sake of conversation, I'll pick type 2 diabetes. And you can see where those boxes were blank a moment ago, you have registry measures that have been populated into each of those boxes. So on the progress note, and we'll take a look at one in a moment, everything that you see on that progress note in terms of those boxes that are available to check off in terms of the diagnoses, medications, services, lab results, and measures, those are all controlled on this form. So if this is important to know, because if you have a CDEMS progress note currently that maybe has too many measures on it, or things that you're not tracking and you think that you may never track at all, you can fix that problem by starting to streamline your progress note to suit only those things that you want and need to track. And that's why I was mentioning in that PowerPoint slide a few moments ago that understanding what you need to report on and combine that with what you want to track, because there may be a difference in those things. Understanding what your data needs are dictate your progress note, which then, drives what your reporting can be.
And it's all tied in by diagnosis. So if you have more diagnoses, then that will add more things, or there may be some overlap.
Right. Thanks, Mary. So these are the measures specifically for type 2 diabetes in this sample data set. So if a patient had type 2 diabetes, these are the things that would be displayed on their progress note. And I'll go ahead and get out of here for a moment and show you that progress note. So here's a diabetes patient. We can preview their progress note. So in that form, all of the related fields that we saw are the same things that will display on this form once it generates. Okay, sorry for the pause there. So here's the diagnosis area and the medications, the services, and all of the related measures. So this person has type 2 diabetes and they have CAD. So like Mary was saying, the progress note is it's all centered on the patient's diagnosis or diagnoses. So we're seeing actually more data fields here than we did just with the type 2 measures because they also have CAD. We can pick a few of these measures and start to pare this progress note down just for an example of something to go through. But we could identify, like the medications, for example. We could hone in on just ACEs, ARBs, and lipid agents and insulin. So we could take just those 4 medications and blood pressure. So we'll pick 5 medications, and whereas we have a longer list of medications here now, let's just presume that maybe there's only 5 that we need for our reporting and want to focus on for diabetes. And for sake of clarity, I'll limit this patient's health conditions to just type 2 so that we don't have other data that's popping up right now. So first things first, I will edit their health conditions and get rid of CAD for the moment and limit it to just type 2 diabetes. Okay. And so back in the utility tab, Setup Wizard, we'll pick type 2 diabetes. And we mentioned ACEs and ARBs, blood pressure medications, insulin. So everything else, things that you don't want to have included on the progress note, highlight it and click the over arrow and it'll ask, do you want to remove this medication? Whichever one you've selected, in this case ASA. We'll say yes. And that doesn't mean that it's removed from the registry. It's still over here on the list of all possible medications that you could include on that progress note, but specifically for type 2 diabetes, it will no longer appear. And we can do the same for beta blocker, calcium channel blocker, glitazone.
Maybe more than one.
Okay, so we'll limit it to those 5 medications. And I'll close that. And we'll go back to the Preview and Print tab, and we'll display the progress note for that diabetes patient again and see how it differs this time. So we've made a couple major changes. One, we removed CAD from their health profile just so we could focus on type 2 diabetes. And then secondly, we limited the medications to just 4. And you can see on our meds list, what we have here are just the 4 medications that we've asked for. It doesn't mean that any of the data on that patient has been removed from the registry, because it hasn't. So if you did have medication information for them that was tracked in the past, and maybe they were on a beta blocker of some sort and you were tracking that, you didn't delete any data, you've simply not displayed it. So there's no danger of deleting information by choosing what to display or not display in the progress note. Another example, maybe the health conditions, the comorbid conditions with diabetes are too numerous and you want to pare that down. So we'll do a couple things. First, we'll pare down the health conditions, and then we could add a new one, or we could add a new medication and show you how to add something onto the progress note that wasn't there before. So back to the utility tab, setup wizard. It's a very repetitive process, so there's nothing mysterious about it. Choose your health condition, and let's stick with CAD, CHF, depression, and type 2. So we can remove everything else that we don't want to see displayed right now.
Data deleted.
Okay, so you see the progress note is getting a lot more compacted. So they have type 2 and they're on an ACE, and that's all we've asked for the health profile, and that's all that's being displayed. The services and the measures work the very same way. Whichever pieces of data that you need to track or want to track, that's what you can have displayed there. Cecil, do you have any thoughts?
Now, you might want to reiterate that even though that thing flashes up that data is deleted, that's just referring to the condition, not the data.
Right. Cecil was cautioning that it might get confusing if you're removing measures from the progress note and you see a message pop up that says that you're deleting something.
It says data deleted.
Okay. Well, I think we'd just be best to change the message that pops up then with some different language saying that you're about to remove a measure from the progress note. Yeah, we can definitely do that so that there's no confusion there. But again, you're not deleting data. You're simply choosing what it is that you want to display. Let me go back to that setup wizard and add something in that wasn't already there before. So utility, setup wizard, we'll stick with type 2 diabetes. And maybe there's a new type of medication that you want to track that's not on the meds list. So you have these boxes. You see we have a box here for new RX, new prescription. Whatever that medication might happen to be, we'll just call it new DM med. Whatever that medication is, you can enter it, click enter on your keyboard, and it'll ask you, do you want to add new DM med to the med list? And here's what we'll call it, just new DM med. And on our list of all possible medications, if we scroll down to the ends, we'll see new DM med. And we can add that medication. So there it is, new DM med. And whenever you display that progress note, and there we are, new DM med. there's not a lot to it. It's a bit of a redundant process. You go back and forth adjusting the progress note as best as you can, but the trickiest part in our opinion is simply identifying those data points that you want to track. There's always room to add measures to CDEMS along the way, and there's always room to set some aside as you find that they're not some of the priority areas that you need to be tracking. Let's see. It's not exactly modifying the progress note. It's a little off topic, but it's still definitely worth pointing out. There's also opportunity in CDEMS to help standardize the data that you're collecting. So like a foot check, for example, if we click on that box, you can see that we can choose between low risk and high risk. For flu vaccine, we can have a completed or not completed. Now, those are also totally modifiable, and I'd like to show you where you can set those drop-down choices for the registry so that whenever it comes time to run reports and run reports by results, you have a more standardized result that you've been collecting for each data element. So I'll close this for a moment. Back to the utility tab. This one is in the crosswalk editor, so right below the setup wizard. The first thing you do, the way this is organized, it's all organized by type of data. So if we were looking at foot check, for example, and that's a service in CDEMS, so we can look at the service, and we can also scroll down to foot check. Now here's the low risk and high risk drop down that you saw earlier. Whatever data or response choice that you would like to have set in the registry could be set here. So we don't have a moderate risk, for example, but maybe we want to add that in. So for sake of argument, let's go ahead and add in a moderate risk to the low and high risk that we currently have. I'll save that. So looking again at that same progress note, foot check, we have a low risk, there's the moderate risk that we didn't have earlier, and now we have the same high risk. So those choices can be standardized, which we presume would make the data collection a little cleaner and certainly make the reporting a little cleaner.
Do you want to talk about the check ranges and the red and so forth, or is that beyond the scope of...
I think that's involved in some of the other sessions, actually,
Okay.
but yeah. I'll pause for a moment and see if there's some questions that we have so far. Or Cecil?
Just wanted to note that if you change the progress note, it impacts on the data you can enter using the progress note form. You have to go to the standard data entry.
Yeah, right. So like Cecil was saying, that if you use the progress note for data collection, it'll become pretty clear that, as you pare it down, you can only collect data on these certain things. That's less apparent if you use the standard form, but it actually works the same way. Yeah, it does. So whatever pops up in that standard form does mirror what's on the progress note.
Okay.
But it's harder to tell because let me show you what Cecil's referring to. So if we add new data using the standard form, well, the diagnoses, no, I see your point, Cecil. I apologize. So on here, we can still choose between, the entire list of possible comorbid conditions. That's not visible on the progress note, right? Same way with the medications. We have our medications pared down to just a few, but using the standard form, you can still see all of them, which is kind of a benefit in a way.
Mm-hmm. But so if you're going to want to collect that data, you're going to want it on the progress note. I guess is probably the real issue.
Right. I hope that made sense to folks. If it didn't, let me know, and I'll continue to pause here and see if there's some more questions that we can answer so far. And I hope that everyone has been able to hear the session. I'm pretty sure that Majuru has not been able to hear any of the session along the way. So I'm glad that this has been recorded. But I'll pause again for questions and see if we have any so far. Okay. Well, if there are questions that come up along the way, please let us know. And if you have, if you'd like an individual support session on this or any other need that you might have in CDEMS, we'd be very glad to schedule that with you and get that taken care of. Like I mentioned earlier, it's been really worthwhile for us to be involved in this, and we've enjoyed resolving some of those larger issues with the registry that you've been having for a while, and just things that have needed to have been taken care of. So data imports, data cleaning, errors with the registry here and there that were popping up. It's really good to get those resolved, and we're glad to continue to find out about those sorts of issues and work with you one-on-one to get those things taken care of. So if there's no other questions, I think I'll go ahead and start to wrap up the session for now and send out a link to Gwen so that the session can be shared with everyone. And I'll also post the recording out on the Wigio website along with the PowerPoint presentation so that all the information that we've presented today can be viewed at another time. Okay, well, thank you, everybody. Appreciate your time. Take good care.